Hey guys, I want to welcome you to relationships with alcohol and other drugs. And I know it says day 5, but I'm gonna do it for day 3. Um, Quiet time. This goal here is a ragdoll exercise, or not a ragdoll exercise, but we're not gonna get into that. This is an opportunity to make the point that stress management can involve both relaxation and energetic movement for stress release. So, what I want you to do is sit quietly for a minute or two and focus on where you are. And let I'm gonna let you pause the video for a minute or two, or I'm gonna stop here so you can relax and focus for a minute. Okay, so the minute is up. Today's agenda is going to be you're going to check in, have quiet time, which we did, explore personal relationship with substances. What does a healthy relationship with substance look like? The continuum. What does an unhealthy relationship with substance look like? Where is your line? And recovery tool. Okay, check in. You're going to emphasize that you need to pick one of the feelings off the feeling chart, or another word that actually describes a particular emotion. Learn to identify your feelings is the first step in emotional management, which will be taught later. You do not need to explain your feelings at this time. All you need to do is identify them. There and the difference between this. You need to talk at length about issues they can make an individual appointment or talk with a super friend. Okay, this is just basically everything we talked about like last time. Session goals. Our relationship with alcohol and other drugs progress along a continuum. Personalize and classify your own relationship with various substances. To understand that our relationships with alcohol and other drugs progress along with a continuum, and this is basically what I've read on paper. So, correct four characteristics of a healthy relationship with a drug. Talk about your relationship with a drug, not not if you're an alcoholic or addict. Surprisingly, for some of you, this may work to reduce defensiveness. Listen closely because you will be quizzed on it later. You will need to know the four characteristics of a healthy relationship with a drug for next week's discussion. Before the break, I want you to begin thinking about where you might be in your relationship with the drug of your choice, the primary drug. Correct characteristics of a healthy relationship knowledge, benefits, no negative side effects, no no freedom to choose. These four characteristics are modified from the book From Chocolate to Morphine: Everything You Need to Know About Mind-Altering Drugs by Andrew Weil. Knowledge: recognition that the substance you are using is a drug and awareness of what it does to your body. Examples of drugs that people don't realize they are using. Read info from pharmacy. Benefits: experience of a useful effect of the drug over time. Why people use drugs, possible useful effects: to treat disease, to alter moods, to escape boredom or desperate or desire, to promote and enhance social interaction, to enhance sensory experience and pleasure, to stimulate artistic creativity and performance, to improve physical performance, to rebel, to get over peer pressure, to aid religious practices, to explore the self, to to establish and identify. Side effects: freedom from adverse effects on health or behavior. Possible effects: uncertainty of dose and quantity, mixing drugs, medical problems, acute problems, example overdosing and allergic reactions, injuries. Chronic problems, example irate and damaged body system. Lifestyle can influence self-care like diet, sleep, hygiene, and exercise. Pregnancy complications: make diagnosis due to drugs changing or making symptoms. Drug-induced aggravated psychotic disorders. Possible side effects: social behavior problems, ration, rational or altered inhabitants, demolished ability to process social cues, distorted of emotional experience, family, employment, school, life-threatening school situations. Development problems, impaired impaired mental development, impaired emotional development, impaired physical development, legal problems, DUI, assault and domestic violence, profession and disputation, dependency and addiction, psycho limit personal freedom, a rate of separation from the drug use of the drug withdrawal, physical, the substitution syndrome, tolerance, more of the same drug for benefit, stronger drug for benefit. Relationship with drugs. I'm going to ask you, does your relationship meet all the criteria of a healthy relationship with a drug? This discussion can be a round robin where you each in turn would identify your own place in the continuum. Personal discussion. This discussion can be a round robin where you each in turn identify your own place in the continuum. It can also be called popcorn style for this discussion, allowing you to volunteer information on your personal continuum. I want to identify your relationship with a variety of drugs, legal and illegal, to develop in using the continuum model. Where are you in your relationship with your drug of choice? If you think you're still on a two-way street, does your relationship meet all the four criteria of a healthy relationship? And you might want to go back and this is the two-way street that they're talking about. And have you passed the no point of return? And again, the no return. This is the no return, point of no return, and this is the two-way street. Right, and that is the end of the slide. So tomorrow, if not tomorrow, sometime this week, will be D6. I know I'm jumping ahead, so it's like I'm going all over the place. But I will be doing D6 tomorrow, so I will be back tomorrow, either tomorrow, Thursday, or between. I know I'll be back with D6 before Friday. So so yeah, I want to thank you guys for watching, and you guys have a blessed day. Thank you.